Jeff Hanks, I think many of you know, he's been an activist for public health care and many other issues for almost 20 years with the London Health Coalition, the Council of Canadians, and the London Regional Social Forum. He has degrees in nursing and chemistry. He is inspired by the World Social Forum, books by Naomi Klein, Maud Barlow, and David Suzuki, and more recently has been particularly interested in fighting for affordable housing. He's traveled all over the world and been to many remarkable lectures by people such as Dr. Bandar, Dr. Jane Goodall, Chris Hedges, Dr. Suzuki, Cornel West, Tony Robbins, etc. One of his favorite quotes is by Margaret Mead: "Never underestimate the ability of a few people to change the world. It's the only thing it ever has." Jeff.
Thanks so much. So I think the greatest, or the most important thing is that the situation is critical in our healthcare system. Ontario patients can't take another 4 years of healthcare cuts, closures, shortages, and privatization. We have to get out and vote to protect and improve our public healthcare system, or we're going to lose it. Doug Ford currently is privatizing core hospital services, and if that happens, as he's doing it now, when he gets back in, U.S. corporations can bid on all they can buy up our entire health care system, rent it back to us at a premium, and then they can make sure anybody with their profits, anybody who runs for office in the future, if they further their interests, they can be funded, and we lose our government, but we lose our healthcare system, we also lose our economy. Our greatest strength and asset we have as Ontarians and Canadians was the decision to deliver healthcare based on need and not ability to pay. It's what sets us apart from the US. It increases equality and decreases income inequality. Our grandparents fought tooth and nail to get it, and if we don't spread the word and vote February 27th, we're gonna lose it. The Americans would love to control our healthcare system. Dr. Day owned one of the biggest private clinics. He was audited and had $500,000 at his private clinic in user fees and double dipping and extra billing. And he probably should have been fined or gone to jail, but he sued. And luckily he lost at the Supreme Court, but he was supported through the back door by the Koch brothers in the States, the Fraser Institute, the Canadian Constitution Foundation. So luckily we won that site, but now Mr. Ford is, he's funding like a private clinic. His ex-health minister lobbies for a clinic in Toronto that's being paid twice the price per surgery as public hospitals get. So that's a big concern. Since he's gone into office, he's diverted over $2 billion from public health care to the for-profit private healthcare sector. There are 1.2 million more people waiting for doctors. Recently, over 1,000 lined up in Walkerton to get a doctor. There's 1,000 more people waiting on stretchers in hallways per day, and he promised to fix this and did not. There have been 1,200 ER closures just last year, which is unprecedented. Ford limiting nurses to 1% raise and then underfunding hospitals has led to many leaving the profession and massive deficits. He's done a lot of cutting since he's got into office, as well as in all sectors. Our hospitals are overcrowded and operating at 110% capacity, underfunded by about $12 billion, according to a comparison to other provinces that puts us dead last on per capita basis.
Shameful.
LHSC has a $150 million deficit at the moment. There's a huge risk of privatization there. I work in a public hospital currently, and I recently showed up to work. It's a 50-bed hospital, but yet we had 69 patients, and they weren't even letting me have a PSW to help me. They said, well, you know, you don't need it, so they won't show up till 9 o'clock. Well, most of the major care has been done in the morning. And I find when even there's a PSW there, I need more than what's there. So the cuts are really affecting the front lines. I'm a RN. So I mentioned the biggest danger of U.S. two-tier healthcare is they can buy up our entire system. But there's also, there was a guy named Robert Tremomus, 2010. He put out an article, and in his article he said, is our economy sustainable without Medicare? So he made the point that private care costs more, there's more deaths, worse outcomes. It's less regulated, they use less regulated care providers. It leads to tens of thousands of nurses, a shortage. We already have a huge shortage, it makes it worse, and wait times are actually longer if we privatize. So those are many of the bad things. As the Health Coalition, we've organized about 6 or 7 debates in the last 15, 20 years, one for each election. We asked the Conservatives many times to show up, and they showed up for 1 out of the 6. And at one time, they said, "Why would you want federal candidates to debate healthcare?" So you know, why indeed? So, sorry, I'm just trying to. So why indeed? It's because the feds provide the funding and need to tie it to enforcing the Canada Health Act and national standards to decrease wait times, for example. There's numerous private clinics and most charge user fees which are illegal. And our businesses compete with US businesses because they pay $1,000 more per employee for their healthcare system. So it will devastate our economy to have it taken over. You know, profits will be even taken out of the country. So it devastates our economy, we lose our democracy, and we lose our greatest asset that sets us apart from the Americans. Even public-private partnerships, they cost us $8 billion compared to how it would have cost publicly. So another thing is that they'll say, well, we should go to a fee-for-service model instead of a global funding model. And the NHS did this in Britain, and what happened was it fragmented care. And so you'd have to go here if you could do the most knees, you'd get the contract. So there were worse outcomes in the clinics. You had to go different places for like knee surgery or eye surgery, fragmented care. And now they've come full circle and determined that they want comprehensive global funding in hospitals because it's really affected their system. And women and children, maternal care and cancer care, because they don't make a profit, they don't get funded as much. So those are really, it's really a bad thing to privatize. We're going to lose public health care if we don't vote to protect it. So what do? Well, neoliberalism, Naomi Klein's Shock Doctrine book has talked about the policies of the extreme right, decrease social spending, decrease taxes, privatize and regulate, and how it's increased, made more people wealthy. It's made the rich richer and the poor poorer. So the Nordic countries, if you read a book called the Spirit Level, they have a progressive tax system. They charge the rich and corporations more, and it levels the playing field. It decreases, it actually reverses the effects of neoliberalism. You know, you have less mental illness, less crime, less infant mortality, teen pregnancy, all the social ills are better, it raises votes. So we need to fight neoliberalism, but one of the other things we need to do is electrify the third rail. So Ralph Klein, I guess in Alberta, he tried to privatize healthcare, and everybody and their dog went to the legislature and said, "You're not doing this." So he had to back off. And when he celebrated that they didn't move towards privatization, he said public healthcare is the third rail of Canadian politics. In the rail yard, the third rail is electrified. So you have to make it so politicians reach out to make money or benefit from our public health care system, they get electrified. Like I mean metaphorically. Sorry. When Wynne privatized half our healthcare, half our hydro, she got 7 seats the next election. So we need to electrify the third rail, which means we need to make everybody in Ontario know that this election is about public health care, not tariffs. And how Ontario public health care goes, the rest of Canada goes. So I just want to implore everyone to, electrify the third rail with me.